in the past, I had a lot of familial trauma. I grew up with a really damaging family, a really mentally ill mother. I was having a lot of suicidal ideation, a lot of severe anxiety, OCD.
Gabrielle was a very complex case, and in many ways, she covered the gambit in terms of all the different conditions or sort of experiential symptoms that we may see in a single patient. Depression, anxiety, OCD, and somatic manifestation of that emotional back pressure. She has neuropathic pain, weakness, fatigue, and that is what's happening to her neurologically. But then she also has what we call central sensitization. In other words, that the mental health and the sort of emotional stress response that became normalized to her is over prioritizing that painful somatic experience. And then she had the additional central pain syndrome of severe migraines.
Growing up in such a traumatic atmosphere and just having all of the life traumas that so many of us have, it can cause a mind-body connection issue, which is the central desensitization. It's sort of like a headache of the body. Everything hurts, everything is overly sensitive. The mind and the body are sort of in cahoots with each other, so it really exacerbates physical pain even more so. It bled into all areas of my life. I was no longer able to enjoy any kind of relationships, any kind of friendships, anything. I have multiple sclerosis, I have Ehlers-Danlos, endometriosis, and when you're operating with those mental disorders on top of physical ones, it is an absolute disaster. I had tried a lozenge ketamine at a different clinic, and while it was a beautiful experience, it just really, it didn't do much. You go home and you're just still you. Not much changes. After doing the lozenges and not having the best experience, I wanted to go for the best. So when I spoke with your clinic, I immediately was like, these people actually care. I came in here not with much hope, just desperation. And I was very surprised. When you come to a clinic like this one, it is much more intricate and personally designed for you and your body and how your system works.
You were getting 2-hour ketamine infusions with a pain direction. When it comes to utilizing the technique that we offer here at NeuroRelief Ketamine, I kind of want people to understand that it's not just oral, intranasal, or single shot intramuscular injection, right? Those don't have a sustained peak effect. But even if someone is giving infusions, there actually is a huge difference in the technique of how that is delivered. So mostly what we call the set it and forget it model, usually underdosed.
You really helped sort of slowly bring me into the, with medication, I believe. Mm-hmm. You would tailor it to my needs of comfortability. And I can't say how much that also helped me. It wasn't just like, bam, you're on ketamine. I was eased into the process
Absolutely.
With the medication, and I felt I went into it in a calm place where I was willing to let the process happen.
What's the difference for you in an oral lozenge dose of ketamine versus the moment by moment customization of a ketamine infusion the way we do it here, so that you're actually like fully outside the range of that whole defense structure to bother you?
It's just not remotely the same, and that's something that I didn't know. I found that completely life-changing, which is very interesting because had I just thought I already had this experience and stopped at the lozenges, I would have completely missed the effects that ketamine can give you. When you're going through a process like this, you need somebody to talk to. Speaking to the integration coach was worth its weight in gold.
True certified integration and recovery coaching with additional subspecialty certifications. This is the coaches that we use. Your coach, Noelle Ceriale, in addition to be a certified life coach, she's also a drug and alcohol counselor. She's got multiple different certifications in different therapeutic modalities. She's got an advanced certification in psychedelic integration and recovery coaching, which is like a multi-year program.
Noelle immediately really impressed me. When you're able to process things with someone like that, it just puts you even more into a calm state, a state of understanding.
And part of that was this somatosensory experiencing modality, which we use very specifically to re-regulate the nervous system, and then also we use it for chronic pain. So how did you feel that the utilization of that technique, where you were being guided to focus and feel differently, both with your own body, your own physiologic state, and then also to start feeling that comfort to feel with that which was around you?
When you want to feel better, and you open your mind to feeling differently and processing things differently in your mind and body, it just really makes a big difference. And it's so helpful to have people around you to encourage you to do that. Before ketamine, I just was in a place where nothing brought me joy at all. Then I got treatment. I'm not someone who just easily believes in things, but it's like the lid was lifted off of my head and I could be me again. You just felt things deeper. Dr. Harris is incredibly involved.
You had been doing the mindful meditation, and of course you and I were sort of 7 days a week nurturing that rebuilding. One of the things we then do is then coaching and helping people refine the application of that into real life. Transitioning that to what we call mindful CBT. Pick a sight, a sound, a taste, a touch, a smell, and thoughtlessly resonate with that.
Something like sitting in the sun, it wasn't just sitting in the sun, it was like you could feel the warmth of it. I just feel very, very happy and grateful for life now, and I couldn't imagine that before. Before ketamine, I was having extremely intrusive thoughts, suicidal ideation thoughts, anxious thoughts, zero self-esteem thoughts. Between the medication and the integration therapy and the meditation exercises, something about that really does change the neuroplasticity of your brain, and you just handle things differently. When I got the ketamine, that volume just really came down. It was so much more easy to manage, especially living with diseases like multiple sclerosis, Ehlers-Danlos, POTS, endometriosis. There's so much pain at all times on top of the mental pain that central nervous system, everything is so revved up that it's unmanageable. And when I did this treatment, it's really just like the volume was significantly lowered and I could go back to who I am outside of all of that pain. There's sort of different neural pathways and you're able to handle those thoughts differently. I was able to experience life without really deep joint pain and migraines and just all of these things that distracted me from being able to feel joy and happiness.
So after your 2-week process, you had a close to 89% improvement in depression scoring, a 79% improvement in anxiety. Migraines was a near 100%. And then PTSD was also significant improvement. It was in the high 80s. And then the somatic pain, you improved by 96%.
I was absolutely shocked to see things actually change when I didn't believe that they could change at all. For me, mentally or physically, I felt like a new person.
And that's not just for the moment. You're actually developing now sustainable new patterns. And this is the difference between just giving someone a ketamine infusion, even if it's well done, and then what we believe our approach is. Because if you want to offer somebody longevity of benefit, right? How long are they able to sustain these results for?
Yes, those things that I learned from this experience, new ways of thinking and processing life. I mean, that is the part that's truly life-changing. What I would say to someone else that is dealing with all of the mental and physical problems that I am is that there is hope. Believe it or not, I was so doubtful, and I surrendered myself to this process, and I was unbelievably pleasantly surprised. It changed my life, and I finally get to be more of me now. I don't talk about things that I don't fully believe in. I fully believe in this. And you made me so comfortable, and I can't be thankful enough.
Thank you, Gabrielle.
Thank you.
Truly a pleasure.